Surviving on scraps: how America's disability benefit system condemns millions to poverty, while other nations lead the way. The harsh reality of American disability benefits. In the wealthiest nation in human history, millions of Americans with disabilities face an impossible choice: survive on benefits so meager they guarantee poverty, or risk losing all support by attempting to work within a system designed to trap them. The numbers paint a stark picture of institutional neglect that would be shocking if it weren't so systematically ignored by policymakers and the broader public. In 2024, the federal Supplemental Security Income SSI payment standard stands at just $943 per month for an individual, barely $31 per day, to cover all living expenses, including housing, food, healthcare, transportation, and clothing. This amount falls dramatically short of basic survival needs in virtually every American community. Yet it represents the primary, and often only, source of income for over 7 million disabled Americans who lack sufficient work history to qualify for Social Security Disability Insurance (SSDI). Even those who qualify for SSDI, which provides higher benefits based on previous earnings, often find themselves trapped in poverty. To remain eligible, disabled individuals cannot engage in subnational gainful activity, defined as earning more than $1,500 per month in 2024. This creates a benefits cliff where any meaningful attempt at employment risks complete loss of income and, crucially, Medicare coverage, a death sentence for many whose disabilities require ongoing medical care. The mathematical reality is unforgiving. In most American cities, $943 monthly doesn't cover rent for a basic studio apartment, let alone the additional costs of utilities, food, medication, and the specialized equipment many disabled people require. The result is a hidden crisis of homelessness, malnutrition, and medical neglect among some of society's most vulnerable members. The international shame: how other nations support their disabled citizens. The inadequacy of American disability support becomes even more glaring when compared to other developed nations, many of which provide comprehensive support systems that actually enable disabled people to live with dignity, rather than merely survive. The Nordic model: comprehensive social protection. The Nordic countries, Sweden, Norway, Denmark, and Finland, represent the gold standard for disability support. These nations operate on the principle that disability should not equal poverty, and their benefit structures reflect this philosophy. In Sweden, disability pensioners receive benefits that can reach up to 65% of their previous income, with additional housing allowances and healthcare that's universally free at the point of service. Norway's disability benefit system provides a guaranteed minimum pension that significantly exceeds poverty levels, combined with extensive rehabilitation services and supported employment programs. Crucially, these nations allow disabled people to work part-time without losing benefits, creating a pathway to greater independence rather than the American system's punitive, all-or-nothing approach. Germany: insurance-based security. Germany operates a disability insurance system where entitlement depends on past insurance contributions, but provides substantial support for those who qualify. German disability pensioners can receive up to 70% of their average lifetime earnings, and the system includes comprehensive medical care and vocational rehabilitation services. German children with disabilities can claim benefits until age 27, 11 years longer than in the UK, recognizing that disability often creates extended dependency periods. The United Kingdom: layered support systems. Despite recent austerity measures, the UK still provides more comprehensive disability support than the United States. The system includes multiple benefit types that can be combined: personal independence payment, PIP, for daily living costs, employment and support allowance for income replacement, and additional housing benefits. While critics argue the UK system has become increasingly restrictive, it still provides substantially higher total support than American equivalents. Canada: provincial innovation. Canada's disability support varies by province, but generally provides higher benefits than the US system. Ontario's Disability Support Program, for example, provides monthly benefits that can exceed $1,200 CAD, plus additional allowances for housing and medical expenses. More importantly, Canadian disabled people retain access to universal health care regardless of their benefit status, removing the healthcare cliff that traps many Americans in poverty. The human cost of American neglect. Behind the statistics lie millions of individual tragedies. Sarah, a 34-year-old with multiple sclerosis, lives in a subsidized housing unit smaller than many prison cells, rationing her medication because her $943 monthly SSI doesn't cover both food and prescriptions. Marcus, a veteran with PTSD and traumatic brain injury, sleeps in his car despite receiving disability benefits, because housing costs in his area exceed his entire monthly income. These are not isolated cases, but systemic outcomes of deliberate policy choices. The American disability system operates on the premise that disabled people should be grateful for whatever crumbs society provides, rather than recognizing their fundamental right to live with dignity and security. The psychological toll is devastating. The constant stress of financial insecurity exacerbates existing health conditions and creates new ones. The social isolation that comes with poverty, being unable to afford transportation, social activities, or even basic communication technology, compounds the isolation many disabled people already face due to accessibility barriers. The false economy of inadequate support. Policymakers often defend meager disability benefits as fiscal responsibility, but this penny-wise, pound-foolish approach actually costs more in the long term. When disabled people cannot afford basic health care, they end up in emergency rooms, the most expensive form of medical care. When they cannot afford housing, they become homeless, requiring costly emergency services and shelter systems. Countries with more generous disability systems often spend less per capita on emergency social services because their preventive approach keeps people housed, healthy, and stable. The Nordic countries, despite their higher benefit levels, often achieve better fiscal outcomes because their comprehensive support systems prevent the costly crises that inadequate benefits create. The trap of work disincentives. Perhaps most perniciously, the American system actively discourages disabled people from working or improving their situations. The benefits cliff means that earning $1,500.51 per month, still well below poverty level, results in complete loss of income and healthcare coverage. This creates rational incentives to remain unemployed even when partial work might be possible. Other nations have solved this problem through graduated benefit reduction systems, where increased earnings result in gradual benefit decreases rather than complete cutoffs. Sweden's system allows disabled people to work part-time while maintaining proportional benefits and full healthcare coverage. This approach recognizes that many disabilities are variable or partial, and that workability exists on a spectrum rather than a binary. Beyond benefits, the infrastructure of dignity. The comparison with other nations reveals that adequate financial support is only part of the equation. Countries with effective disability systems also invest heavily in accessibility infrastructure, assistive technology, and supported employment programs that enable disabled people to participate fully in society. The Netherlands, for example, combines adequate benefits with extensive accessibility requirements and subsidized assistive technology programs. German cities are required by law to ensure public transportation accessibility, and employers receive substantial tax incentives for hiring disabled workers. These complementary systems create environments where disabled people can live full lives rather than merely surviving on charity. The political economy of disability poverty. The persistence of inadequate disability benefits in America reflects deeper ideological commitments to individualism and market-based solutions that fundamentally misunderstand disability. The American political discourse treats disability as a personal tragedy, requiring minimal social response, rather than recognizing it as a natural part of human diversity, requiring collective adaptation. This ideological framework makes it politically easy to ignore disabled people's needs. Unlike other marginalized groups, disabled people often cannot engage in traditional forms of political activism due to health limitations, transportation barriers, and energy constraints imposed by poverty itself. They remain largely invisible in American political discourse, their voices systematically excluded from debates about their own lives. The COVID-19 revelation. The COVID-19 pandemic briefly illuminated the possibility of different approaches to social support. Emergency unemployment benefits, stimulus payments, and eviction moratoriums provided many Americans with a glimpse of what basic economic security might feel like. For disabled people, these temporary measures often provided more support than their regular benefits, revealing just how inadequate the baseline truly is. The pandemic also demonstrated that society can rapidly adapt to accommodate disability when necessary. Suddenly, remote work became possible, digital accessibility improved, and social distancing measures that disabled people had long requested were implemented overnight. This revealed that many barriers to disabled participation are choices rather than necessities. International lessons for American reform. The experiences of other nations provide a roadmap for American reform, if the political will existed to implement it. Key elements of effective disability support systems include adequate benefit levels. Benefits should provide sufficient income for dignified living, not mere survival. This means regular adjustment for inflation and regional cost variations. Graduated work incentives. Rather than benefits cliffs, systems should allow gradual transitions to work with proportional benefit reductions that never leave people welfare off for trying. Universal health care. Disability benefits become meaningless if recipients lose health care coverage for attempting to work. Universal health care systems eliminate this trap. Complementary services. Benefits must be paired with accessibility infrastructure, assistive technology, and employment support services that enable full participation. Rights-based framework. Effective systems recognize disability support as a right, rather than charity, creating legal entitlements rather than discretionary programs. The moral imperative. Ultimately, the comparison between American disability policy and international alternatives reveals a profound moral failure. In a nation that spends trillions on military hardware and corporate subsidies, the claim that adequate disability support is unaffordable rings hollow. The United States has the resources to ensure disabled citizens live with dignity. It lacks the political will. Research shows that in 2021, the average share of disability benefits within total social protection expenditure was just 6.9% across EU countries, suggesting that comprehensive disability support need not dominate national budgets. The issue is not cost, but priority. Other nations prove that different approaches are possible. Their disabled citizens live fuller, more secure lives, not because those countries are wealthier. Many have lower GDP per capita than the United States, but because they have chosen to prioritize human dignity over abstract fiscal concerns. Conclusion: a system beyond reform? The evidence is overwhelming. America's disability benefits system is not merely inadequate, but actively harmful, trapping millions in poverty, while other nations demonstrate that comprehensive support is both possible and affordable. The question is whether the American political system is capable of the fundamental transformation required. Incremental reforms, small increases in benefit levels, minor adjustments to work rules, will not address the systemic failures that condemn disabled Americans to lives of deprivation. What's needed is recognition that the current system is not broken, but working exactly as designed to provide minimal support while ensuring that disabled people remain invisible and powerless. The international comparison reveals not just policy alternatives but moral ones. Other nations have chosen to treat disabled people as full citizens deserving of support and opportunity. America has chosen to treat them as burdens to be managed with minimal expense. Until this fundamental orientation changes, millions of disabled Americans will continue surviving on scraps in the world's wealthiest nation, their potential wasted and their dignity denied by a system that values ideology over humanity. The path forward exists, proven by nations around the world. Whether America will choose to follow it remains an open question, one that will ultimately be answered not by economic arguments, but by moral ones. How we treat our most vulnerable citizens reveals who we truly are as a society. By that measure, America's disability policy stands as a damning indictment of our national priorities, a source of shame that no amount of rhetoric about American exceptionalism can obscure.